Karshner, welcome back to Geological.
Thank you. Thank you. Great to be back.
So happy to have you. You were here with us a couple of few shows ago, quite a few. Show number 55. We were investigating the subject of constraint with the liver
Yeah.
and that whole thing. And you're currently working on a book, and it's about, correct me if I'm wrong about this, but it's a book about modern Chinese medicine, where it's come from, some of the changes that it's gone through over the years, including being considered the go-to medicine for like acute conditions. And now we often think of Chinese medicine as being something for the more chronic conditions and not so much for the acute conditions.
Yes, that's right. I mean, in general, the book is about how Chinese medicine is practiced in China today. And I think, I mean, this might not surprise your listeners too much, but it's extremely hybrid. It's this mixture of Western medicine and Chinese medicine.
You
Certainly,
know,
anyone who
I'm not sure that the listeners know about that for sure. I mean maybe if they've been to China, but there's often this idea in our community that China's where it came from and that's where the real medicine is. And I mean, how would you describe medicine in China these days?
I think it's very diverse and it's super interesting. But certainly, one of the things that blew me away when I was there studying and in school was just how kind of freely doctors would combine, both Chinese medicine and Western medicine, and this is both sort of like for the purpose of diagnosis, but also for treatment. The training, very much, the medical training there requires students to really become really masters of two types of medicine. And then, I don't know if I was totally ready for this, but it's not that surprising that when you get to the hospital and the clinics, you're really doing both as well. So yeah, so the book kind of looks at that phenomena and tries to sort of unpack it and kind of give some of that history and explore how we got to this kind of very unusual, unusual place. I also think it's very interesting. I don't want to dismiss it. I think there's that kind of combination of two medical systems leads to a lot of interesting innovations. But it's also complicated too because sometimes things get lost in the process, and I think that's today what we'll talk about a little bit is one of the things that didn't quite make it into sort of the more contemporary practices of Chinese medicine today.
Yeah. So what I'd like to dig into with you today is basically how Chinese medicine became sort of famous for being the medicine for slow or chronic diseases.
Yeah, so this is a super interesting topic, and I'm not so sure if that's what American practitioners think, but that's for sure. If you're studying in China, you learn pretty quickly that Chinese medicine, the thing that's really good is for those chronic diseases. But when it comes to things that are a little bit more acute, maybe something infectious, emergency medicine, that's like the realm of Western medicine.
Right. Well, I'll tell you, when I was in China, I was shocked and frankly sometimes pissed off
Mhm.
when Chinese people, they'd find out that I practice Chinese medicine. They go, "Oh yeah, Chinese medicine, that's so great. For acute problems, of course you want Western medicine.
Hmm. Hmm.
But Chinese medicine is good for the slow stuff." And I'd look at them like, "Are you stupid?" Because even as a young practitioner, I should say a green practitioner, somewhat new out of school, we'd see all kinds of things where, like the common cold, for example, if you really get that thing at the right time in the right way, you don't get sick,
Yeah,
right?
I
It can
mean,
turn that stuff around so quick, but again, there's just this perception. There's this perception over there that the Chinese medicine is better for the Manqing Bing and not so much for the acute stuff. So what happened? How did it go from being a medicine that you would use for anything to relegated to the chronic diseases?
well, so how did we get to this state? Well, first up, maybe I agree with you. Something like a cold, maybe a headache, you can turn that around pretty quickly with some acupuncture or some herbal medicine. But to kind of defend the doctors a little bit, I think in hospital practice, you're often confronting something very, very serious. So let's say somebody comes in with let's say a child comes in with a case of pneumonia.
Hmm.
I mean, that could be life threatening. Do you say, let me experiment with an herbal formula here and see how that goes for a day or two? Does that child survive your experiment, or do we like go with like antibiotics, which we feel pretty confident are going to be like are going to work, or they're going to be at least we're going to be following sort of proper standard of care. So I think there's a context in China where doctors are feel like it's a risk somehow to deviate from Western medicine, particularly when it's acute, but also these very serious conditions. Um, and and I have to say, as a student there, I mean, I would sometimes question some of my teachers. I mean, I remember being in the the wards of a particular hospital I was training, and seeing doctors prescribing antibiotics for patients with infections that weren't quite, this wasn't necessarily emergency room medicine, but it seemed to me there maybe you could try to do something herbal. I didn't know if it would work or not, and I'd ask them, and they would, be a little bit perplexed by the question. They're like, well, I don't know if you want to do that. What if what if we make a mistake? People are going to be, then my job's on the line. They were
Sure.
nervous about it. So,
Well, I mean, I think
yeah,
we have the same concerns here. There's certain things maybe we could treat it herbally, maybe we could treat it with acupuncture. But for example, with antibiotics, for sure, in many cases, that's just going to be the thing that knocks it out.
yeah, yeah, for sure. I mean, uh, I've had some of those own dilemmas, like with my kids, thinking of
Yeah, bring it home.
yeah, thinking of a time when when my eldest son probably had a strep throat, but it was like the weekend the pediatrician's office is just closed, and I just realized that's probably what's going on here. Am I going to try and treat that herbally, or are we going to go to the ER? Are we going to how are we gonna play this one out? In that case, actually, the herbs did work, so I'm happy to say we didn't end up in the ER, or on antibiotics. But well,
Right. But
so
but these are very real concerns, and especially for those of us practicing here in the States, um, there's issues of scope of practice, and there's issues that if someone didn't go to didn't go to the doctor, and then things get worse, if we hadn't made referrals in a certain amount of time, that could come back on us.
absolutely, and I think the big difference is that for us that we tend to get patients here in the U.S. that have probably they've been to the ER. They've seen their primary care physician. They've seen a specialist, so they're usually already more in that kind of chronic state, and so they kind of come to us like that. And we aren't kind of confronted with that existential dilemma, like do we treat, or do we refer, or what do we do? But whereas in China, many patients will go to a hospital of Chinese medicine or a clinic of Chinese medicine as the kind of their very first stop. They're just sick, and that's what's close by, and they expect
Hmm.
doctors to be able to make those calls and decide if they're. And since doctors of Chinese medicine are very skilled at Western medicine, they expect them to decide, okay, treat it with Western medicine or Chinese medicine. You do whatever is best. So in that context, you can certainly see why doctors of Chinese medicine are nervous to kind of call on some of their skills to treat acute
Sure.
conditions with Chinese medicine. And that was just something that that was just the kind of the water we swam in as a student there, and I don't think I really questioned it too. I mean, I wanted it to be different, but I don't think I questioned it that much until I started doing some research, and really it was uh, almost really an accidental discovery to find out that actually in the early part of the 20th century, Chinese medicine was considered to be not only good at, but really that was kind of its greatest strength, was to treat acute illnesses.
Yeah, that's such a. I think it's probably a big surprise for so many of us to consider that. If we don't have some understanding of the history, how did you somewhat accidentally stumble across this?
Very luckily, I got some research money, and to go interview some very senior doctors of Chinese medicine, and that was the project specifically, was to collect some oral histories. and at this point was already done with my sort of PhD dissertation, which is now sort of the thing that's soon to be the book manuscript. And I knew from kind of all my previous research that it was clear that a lot had gone on. A lot of things had changed in the communist period. I knew that we have these new textbooks that kind of only go back to the 1960s. Obviously, the universities and the hospitals of Chinese medicine, those almost, except for a couple of exceptions, really go back to the 50s and not any earlier. So it's clear that sort of like all the modern institutions of Chinese medicine are these things that were built in the communist era. And it was clear that must have done something to the practice, but I had a hard time putting my finger on it. So I really wanted to interview some doctors who had studied and trained, in the Republican period. This is sort of 1911 to 1949, and sort of get their thoughts on it, but not totally knowing what I'd find. But so this is a project that I got some money for back about 10 years ago, 2000. I was doing this research about 2009. And at this time, there's still, sadly, a lot of these doctors have passed away, but at this time, there was those doctors who had sort of practiced in, say, like the 1930s, maybe grew up in the 20s and came of age in the 30s and 40s, were kind of in their 80s and 90s at that time. And I had some kind of amazing assistants to help me track down a bunch of these doctors. And I ended up interviewing almost 40 doctors.
Wow, that's quite a few.
It was a lot.
And those doctors lived in such a time of upheaval and difficulty.
Oh, they've been through so much. It was by far kind of the most interesting research I've ever done. And I was of course, thrilled to meet a lot of them. I didn't exactly know where you go finding old doctors of Chinese medicine, but the people that I sort of knew about from my reading and my research were some among the more famous doctors. So that's sort of who I went for. I was like, and I would kind of enlist these amazing Chinese friends and assistants that helped me sort of track them down. And so kind of in the process, I got to meet sort of some of my heroes, the people that I was whose books I'd been reading or who I had heard all these amazing stories about. And it sort of and as a result, sort of traveled kind of all across the country, kind of up to Harbin in the northeast, down to Guangzhou in the south,
Wow.
out to Sichuan in the west, Lanzhou even.
So you were all over the country. That's not a small country either.
Yeah, it was a lot.
These-
It was a lot of traveling. Yeah, yeah.
Yeah. And tell me again how you manage to track these kinds of folks down. I mean, it's one thing to know someone who's famous and maybe you call their publisher or something, but
Right.
I mean, how do you even figure out who to talk to?
Well, I mean, all the credit goes to basically two women, Huang Fan and Li Chao, are two very dear friends of mine. Both of them happen to work in the film industry, and Huang Fan, someone I had known for many years. So I was trying to do this on my own initially, and in fact, I remember there was a doctor in Beijing. I was living in Beijing. I was really keen to interview him, and I found out where he was working, and I managed to kind of go to the hospital. And then I even kind of arranged through sort of hospital administrators to kind of shadow him in his clinic, so I got to see him practice a little bit, which was fascinating. And I had to pay a good bit of money to do that, but then then I would sort of try to approach him at the end of a kind of a clinical session at the end of a morning, but basically he was sort of immediately kind of whisked out of a room, and there was sort of a whole number of students surrounding him, and I'd try to talk to his daughter, and basically I got after a couple of months I got nowhere, and I couldn't convince this guy to like agree to an interview.
You were not buying him the right kind of cigarettes.
Yeah, clearly, just asking nicely was not enough, and kind of out of desperation, I was getting quite desperate and I was like, this project is it's never gonna work. I don't think I can do this. I can't even get this one person to talk with me. I'm not gonna repeat this in cities across the country. And about this time, I kind of was bumped into my friend Huang Fan, who was working in the film industry, and she just was telling me about a film project she had been working on, and she would often help with production stuff. And she had just set up some really complicated shoot in a factory down in the south of China, and she told me about how they like got the factory to like stop production for a day, and they got the workers to do all this and that, and like and
Oh, you
everyone
need
like
someone
told,
like this, right?
yeah, and exactly. I was like, oh my god, you did that? She's like, yeah, that's what I do. That's my work. And I was like, do you think you might be able to help me with my work? And she was being a coach. I started telling her about it. She's like, oh my god, that's so easy for me. I would be love to
Yeah,
do that. And
right.
that's much more interesting than my films. Like, I really like your. I'm interested in your research. Yes, let me help you. And then
That's hilarious.
yeah, so it's very funny. So she started helping me, and then and her cousin Li Chao also started helping me, and they were unbelievable. So I mean, really, all the credit goes to them. Um,
You know, it just goes to show you, 如果有关系那没有关系. If you got the connections,
yeah,
it's just not a big deal,
yeah,
right?
totally. And you just knew. It was really a matter of like asking the right people to help, and they were
Yeah, right. And they're
so the
happy
right.
to.
Yeah, they were so the right people, and it was so easy for them. And
So you finally got to talk to the Beijing doc.
and that one doctor in Beijing actually never agreed to an interview, interestingly. So I was like,
Oh,
asking I started with like the very wrong person, and of course they called up like, dozens of, I would just give them lists of names and they would call them all up, and not everyone agreed, but a lot did agree. Some of them, now some people were, a lot of them were quite elderly and very sick. And so it was hard to know just who was kind of going to be available or well enough to talk. But many were excited, about the project, and so it eventually got up to about 40 doctors. So that's uh, um, so it was that was definitely a good. I think to me it felt like a good sample. These maybe among the sort of more elite doctors for sure. Most of them went on to have at least some local fame and whatever part of the country they're from, and some of them were, a few of them were quite famous, like nationally known.
hmm.
Um,
So can you take us back to, say, early Republican period
yeah,
and paint the picture of what it looks like to be a Chinese medicine doctor back then?
yeah, for
Or I
sure.
mean, or even how you learned to be one. I mean, they didn't have the Beijing, school of Chinese medicine back then, I don't think.
Yeah, that's exactly right. And so, I mean, I started off asking them some of those questions. So, how did you study Chinese medicine? And well, one of the, and this is also part of the picture here, and kind of part of my paper on this was one of the things I remember being interested in kind of asking about was why would you want to study Chinese medicine? And if we have and for those of us who have like who've read a little bit of some of the histories of the Republican period, that period is sort of famous for this big clash between doctors of Chinese medicine and Western medicine. And in 1929, American students may or may not be aware of this, but there was a proposal by some ministers in the new government under the nationalists to abolish Chinese medicine. Uh, it's a proposal that failed. There was an actual bill, though. It failed to pass. But if you like me were studying Chinese medicine, in the 1990s and 2000s, that's like standard history that you learn, and you learn about sort of all these nefarious politicians and actors who were like out to kind of get Chinese medicine and stop it, because Chinese medicine was in the minds of sort of some of these more radical political figures and intellectuals, was something that was holding China back. It was preventing China from modernizing.
So it
So
was that crazy superstitious stuff.
it was superstitious, and it was literally sort of almost to make a little bit of a pun here, sort of infecting the minds of the
Mm.
average person and preventing them from like learning about like the modern world, and the sciences, and the ways a society should run. And that's kind of the standard history that all of us will learn. If you're a student in China, that's what you learn. And if you're here in the U.S., and if you get into that history, that's sort of the standard history you might encounter. So I remember one of the first questions I was asking an interviewee was, why would you want to study Chinese medicine at this kind of time of like tremendous contentiousness. And it was still contentious in the 90s, but it was much more. It seemed to be much more so in the 20s and 30s, at least from the history that I understood. And his response totally threw me off. And he says, well, I was just a and this was a doctor named Li Jianhua from kind of Hebei. And he said, well, I was just a kid from the countryside. I didn't know there was two kinds of medicine.
Oh, wow.
And that just floored me. I was like, oh, really? Like, I mean, all these sort of battles that sort of seem to be raging, and you can read about them in journals from the period and stuff like that. You knew nothing of them. He's like, no, I had no idea. He said, in fact, it was only, and this is sort of, it was only later when I moved to Beijing, and he had originally studied with I think it was his uncle, if I remember correctly, and did a little bit of an apprenticeship with him, but then later went to Beijing and to study at one of these new schools. At the time, these were sort of these new private schools, different from the modern schools, which are state-run, but a precursor to them. And he said, it's only when I got to Beijing that I even learned that there had ever been this debate, or there was even another kind of medicine. He said that was just, he said, I
Right.
had no idea.
If you're from the countryside, you wouldn't. Western medicine had not penetrated its way out there yet. It was more in the cities,
Yes,
places where there's, booming economies,
yeah.
and then it was more of an intellectual thing.
Yeah, absolutely. So that was definitely one of the stories that I heard over and over again from any doctor that was from the countryside. There was almost, no such thing as Western medicine in the countryside. And if there was, it might be like, as one doctor put it to me, it might be like kind of like somebody who was like a nurse in the army, maybe more like a paramedic even, who like knew a little bit of Western medicine and kind of went to the county seat and put a stethoscope on and a white jacket. And he said, to be honest, those people, they didn't know anything about medicine, just broadly speaking. They weren't good doctors. So there's very little exposure for most people in the countryside. But even in the cities, the numbers, it turns out, were just very, very limited. There were just not a lot of doctors of Western medicine. It was still a really new profession in the
So
20s and 30s.
did they not even think of it as Western medicine and Chinese medicine? It's just medicine. Oh, that happens to be
Yes.
Chinese medicine.
I think so. I think so. Definitely for some of the doctors from the countryside, and it's only like this encounter is kind of happening, in urban spaces, among kind of more elite doctors in the 20s and 30s. But I think for maybe your more average doctor, there's not that much is known. And so if you were to go back and then later, I've done a fair amount of archival research, and so if you go back and read some of the more famous writings, Chinese medicine writings from the Republican period, then there was a whole group of doctors who were very interested in Western medicine, but they were primarily like sort of self-taught, and they were very small in number. I think the average doctor just wouldn't have had a place to go study that, just to go study Western medicine, and so wouldn't have known much about it.
Right. And also at this time, I'm thinking this is before the antibiotic era. So,
absolutely.
So how much did Western medicine have to offer other than maybe certain surgeries?
Yeah, so that's a huge point. So we tend to forget the history of Western medicine as well, so yeah, antibiotics really aren't on the scene until after World War II, and then a place like China, they're going to be very even they're going to be limited even then. But one of the things I kind of gradually realized through some of these interviews is that, and this would be so different than today, but really, doctors of Chinese medicine, at least sort of the elite doctors, the really good doctors, consider themselves much more competent physicians than sort of their Western medicine counterparts. They're like, what can they do? They can make a good diagnosis, but they don't have any treatments. So that's the usual rap.
Mm-hmm.
And I think so. It was out of that kind of context and that situation that doctors of Chinese medicine had to treat everything. And so again, in some of those early interviews, I remember kind of casually asking, so okay, so you didn't know much about Western medicine? What kind of things were you treating, at your clinic or your dad's clinic or your uncle's clinic, that sort of thing? It was, and the response was, oh, well, smallpox, cholera. I remember the bubonic plague epidemic of 19 something, 42 or whatever. And I was kind of just sort of falling off my chair, initially thinking, wait, is this like, I think the very first time a doctor kind of gave a response, something along those lines was, I really thought I was just being had. I thought he must think I'm maybe a gullible foreigner. He's just gonna tell some tall tales, and I'll believe it, and maybe write something great about him, or I don't know what. And I just really didn't believe it. But of course, doctor after doctor really gave the same response. And then if you were to say, so tell me, how exactly do you treat smallpox? And I could get like these very elaborate answers, like, oh, well, here's exactly how you do it. And of course, this sort of stuff is actually, I mean, not surprisingly, it's kind of all there in sort of the written text of the time too. But that's because we don't tend to think of Chinese medicine being good at these treating acute illnesses. People just haven't really looked for it. And so once I started looking for it, I was like, oh, it's everywhere. Like, this is, of course, exactly what doctors were doing and writing about in their clinics. Yeah, so there weren't a lot of alternatives in Western medicine. And as one doctor put it to me, there also, was a time when there was like a lot of illness. There was war. War with Japan begins, in 1937. People didn't have time to be going to their local doctor to be treating their chronic whatever fibromyalgia, this complaint or that complaint.
Oh man, no, people must have been dealing with much more acute issues.
Yeah, exactly. So they really went for like the most emergent, acute, important kinds of conditions. And the other thing that sort of surprised me too is that doctors told me, unlike today, where it's not uncommon to kind of go to a hospital of Chinese medicine and see a patient walking out with, literally like a shopping bag, full of herbal medicines, enough for a month or something like that. Patients at that time, they only ever bought like 1, 2, maybe at most 3 prescriptions of medicine. And so the idea was like, we're gonna see some results with 1 or 2 prescriptions, or I'm gonna go find another doctor.
They just didn't have time to mess around.
So there was no time to mess around, and people needed results, but they also expected results, and good doctors of Chinese medicine could get the results. And so I think one doctor put it to me best. He said, if you're going to be famous, if you're going to make it really as a doctor of Chinese medicine in that Republican period, you were going to make it because you were good precisely at treating acute illnesses.
Mm-hmm.
Yeah, not because you had some good treatments for any real chronic conditions. Yeah.
So all these docs that you interviewed, they all had a lot of experience with treating acute situations.
Mm-hmm.
And some of them even probably became famous as doctors because they were good at treating it.
Yes.
Precisely.
Precisely.
Oh, you got bubonic plague. Yeah, go see Dr. Joe over there, right?
Right.
So what happened?
Good question. And I think it's a complicated answer. And I kind of sort of, as I proceeded in my interviews and I became more and more confident that there really was this profound shift that had happened, I started asking more and more about that. And so I got different answers. So I suspect it's probably not any one thing. And I think there's probably some regional variation. But I could probably give a couple reasons. So one with we have to even back up a little bit and kind of recall or understand, I guess, properly how Chinese medicine was practiced in the Republican period versus how it's practiced today.
Oh, I'm glad you bring that up because it's so easy to think, oh, hey, I practice Chinese medicine. We, right, collectively have been doing this for thousands of years.
Yes.
But at the same time, somebody practicing in China in 1920 is probably going to be having a very different life than us practicing in 2019.
Yeah, absolutely. Now, if anything, maybe the doctor in the 1920s is maybe a little bit closer to, like, say, like the acupuncturists here in the U.S. in that Basically they had some sort of private practice. It was just usually the doctor on his own, or maybe working with a relative. Um, you kind of hung up a shingle, so to speak. Um, and the typical pattern, I mean, this could vary a little bit, but it was usually you'd have in the morning, you'd have patients come to you in your clinic, and you treat them on an outpatient basis in the morning. And then the afternoon, you would go to the homes of the sicker patients who are willing to kind of pay you a little extra money to make that trip. And you might walk, or if you were had a little more money, or the patient was paying for it, maybe you get carried in a sedan chair or something like that, and you would make these house calls to the sickest patients who are all at home. So there's really, and that, at least for compared to contemporary doctor of Chinese medicine, is just profoundly different than working in a hospital, which is an institution, with bureaucrats and rules and medical records and diagnostic technologies and all the trappings of sort of modern medicine. So one of the things that happens kind of in the after 1949 in the establishment of the People's Republic of China is that the Communist Party is very interested in building what they would consider sort of a proper national healthcare system. So they're investing in hospitals, and they're trying to kind of build up this infrastructure. And so very quickly, sort of, within kind of 10, 15 years, there's just less and less private practice. And even doctors of Chinese medicine are encouraged to form like little group practices and kind of collaborate. So they're becoming, so their practice is starting to change. And then as the, sort of hospitals are starting to be established by the kind of late 50s. Well, first kind of Western medicine hospitals and there's some of those already around, but there's more being established in the early 50s. Chinese medicine hospitals sort of come next in kind of the mid to late 50s. Then you're sort of pulling, doctors from those various small clinics all around the city into into these bigger institutions. And then, but a couple of things happen there. One year, I suspect there was probably some sort of depletion, a little bit of sort of what had been maybe a more robust practice in the countryside, because you're pulling doctors into the cities. But then in these hospitals in the cities, the hospitals are really being modeled on hospitals of Western medicine, and the administrators aren't doctors of Chinese medicine. They're usually sort of bureaucrats with some Western medicine background. And so I think one problem that I heard that came up was, for example, you might not, any patient with a fever, any patient with a fever or some kind of acute condition, probably something infectious, was not allowed to be treated by doctors of Chinese medicine. And that was just sort of like,
Oh, wow. And just prior to this, that's where you would go.
that's right. So, and that's where you would go. And I asked another doctor about that. I said, well, but patients knew that, I mean, they couldn't have forgotten that Chinese medicine doctors were so good at this. He said, well, they didn't, it wasn't immediate. He says, but in the 1950s, other things were happening too. So for example, a big thing with the communists was kind of a new health insurance system, which wasn't for everyone yet, but it was definitely for anyone who was sort of in a state-run work unit, whether that a university or maybe a state-run factory of some sort, or some that they were getting some kind of free or highly subsidized healthcare, but that healthcare often directed them to like hospitals of Western medicine. And so then patients were like, oh, so this is what a hospital of Western medicine looks like. And then I can get an x-ray here, and I can get some blood work done.
Does my insurance cover this?
My insurance pays for this. Okay, this is kind of neat. Let's do this. And let's get,
Yeah.
and so more I think through a series of measures along those lines, some of it more restrictive, some of it kind of like encouraging more people to go more towards Western medicine, you kind of get this big shift. Plus you have sort of a whole profession of Western medicine doctors that are emerging that are totally biased against Chinese medicine. They're for the most part, not every one of them, but for the most part, they tend to be sort of looking down on it. So this new kind of hospital institutional form of Chinese medicine is emerging, but it's one that either not allowing doctors to treat acute illnesses, and so young doctors are not learning how to do that, or it's sort of taking patients and encouraging them to see more doctors of Western medicine, and that profession is growing. And then things like antibiotics are becoming available. And so I think a number of factors kind of play in. But I think, probably by my guess is probably by the early 60s, you're already sort of seeing this like new way of thinking about the two medical professions, and more and more Western medicine is just going to be this thing that's good for the acute stuff, and Chinese medicine is going to be good for the chronic stuff.
So it sounds like there were a couple of influences that came together. One was the hospitals.
Mm-hmm.
So they're being pulled away from their private clinics, where they were treating everything.
Mm-hmm.
And then you've got hospital staff, which is saying, "Oh, you got this disease, you got this, go over here. You got this, you go over there." You got these hot young doctors that are doing Western medicine along with some incredible new drugs now, which, let's face it, antibiotics are flipping miraculous for some things, right? Super powerful weapon, very, very helpful medicine.
Yeah, especially like penicillin when it's like first around and there's
Holy
no resistance
smokes,
to it.
I
Yeah.
know. Can you imagine having grown up in an era when there was no penicillin and then penicillin shows up? All these people that otherwise would have died are now living. I mean, it must have looked incredible. And so, like you were saying, then partly what happens here is because the young doctors are not learning this from the old doctors,
Mm-hmm.
we start to lose it.
Yeah. And I think there's another, maybe a couple other factors too. One is, these kind of go together. The Chinese government is really investing in Western medicine in the 50s, and so and really trying to like develop that professional core of practitioners. And so you go also from a situation where there was a really profound sort of, to say, demographic imbalance of favor of Chinese medicine in the 30s and 40s. You might say I think I saw one estimate that in the city 9 out of every 10 doctors would be a doctor of Chinese medicine, but in the countryside maybe like 99 out of 100 doctors would be a doctor of Chinese medicine. And so pretty quickly those kind of proportions start to change, and you're getting more and more doctors of Western medicine being trained. Chinese medicine doctors are losing maybe a little bit of their social foundation. I think kind of also related to things like land reform in the countryside. So you can imagine in the countryside that in a typical village pre 1949. A large percent of that village was probably illiterate, maybe something like 10 to 15. That's a sort of estimate I've seen would have been literate. And so you're probably, your doctors, at least sort of doctors who are going to be practicing that more literate form of Chinese medicine that we tend to associate with Chinese medicine today. Of course, in the Republican period, there was a much more diverse group of practitioners, but there's less and less of an ability to sort of pass on at least those sort of more literate and elite forms of Chinese medicine, because landlords are, they're now social pariahs. They don't have the means or the status to like then send their children to like study with a doctor. And so some of those kind of older systems of like transmission of knowledge are also kind of being disrupted in the countryside. News systems, that are more urban based, that are really emphasizing Western medicine, are kind of being really promoted at the same time. And I think together with that is also this emphasis really pushed by the Chinese government that doctors of Chinese medicine need to get more modern medical training. So by the mid 1950s, doctors of Chinese medicine then are also like getting training in Western medicine, first kind of short courses. If you're an older doctor, you would take probably a course on anatomy and physiology or something. But if you're a new student, and as new schools of Chinese medicine are opening, and this begins in 1956, and then kind of spreads to more and more cities as the schools are built. All the new school curriculums really emphasize a very strong foundation in Western medicine. There were some changes over the years, but roughly the curriculum sort of I encountered in the late 1990s is pretty similar to kind of like what was around back in the 1950s, which is you're going to spend about half your time learning Western medicine and half your time learning Chinese medicine. And that's just kind of a profoundly different situation than what these older doctors encountered. Like they learned, their training was just Chinese medicine. They maybe later picked up a little Western medicine if they were interested in it, but they began with the Chinese medicine. They began probably with the classics, and they also began in their teachers' clinics. So like right away, they're seeing patients, and they're seeing, oh, this is a Guijia tongue. situation here. You know,
Well, I would suspect that they were in the clinic with their teacher learning about stuff before they even had any deep background in theory. They're just in there watching this happen, and the teachers are saying things. Oh yeah, this is a Guajartong presentation, and they're like, whatever that means.
that's right. That's right. But that kind of gets tucked away, and then they see it again, and so they're in the clinic from the very beginning, and they're also memorizing stuff. And this actually I had an interesting conversation with one doctor. I remember this one of those early doctors who was both started in the countryside and then later went to the city. And so I said, okay, this is really interesting. You started kind of like with studying with your uncle, so this master disciple approach to transmitting medical knowledge, and then later you went to like this new school. It wasn't quite like the modern state-run schools, but it was a similar model of it was a privately run school, but a similar model with some textbooks and things like that. And I said, so which one did you think was better? And he said, well, it's interesting. He said, that the school certainly was more systematic. Like I learned like a little bit of, all the different kind of branches of medicine, if you will. He says, but I got to tell you, he says, that he said, I know it's kind of a stupid method, but the stuff I did with my uncle, where I just like memorized, all these sort of classic texts. He says, that's the stuff I think that helped me the most.
That's interesting, isn't it?
Yeah, really interesting. He said and then he said, because it's stuck with me. And then he started like rattling off like passages from what was it? I think maybe it was the Bing Hu Mai Xue, the book on pulses by Li Shijian. And I was just like floored. He was like, in his 80s. He said, "See, I still remember it."
Well, there's got to be something. I remember one of my teachers talking about this when I was in acupuncture school, that even though it's not our forte here in the West to memorize things, and we don't necessarily like it when we do, if we memorize it, if it's just somehow in there, it's in our, it's like tucked away in there somehow, that when we run into certain situations in the clinic, those lines will come back to us.
Mm-hmm, mm-hmm. I mean, that's very much the sort of thing I heard from all these doctors. That it's kind of like it's there. Sadly, I think I was too old when I started to really memorize a lot of that stuff. But yeah, it's there, and that was still emphasized to an extent in the schooling that I got later in the 1990s. Of course, students were a little bit older, and I was much older, and I'm working in a foreign language, so it didn't go as well for me.
Well, even when we're studying Chinese medicine in English, it's still a foreign language.
Yes, yes.
I mean, we're using words that are English, but the way that we have to reshape our thinking and understanding and perception, it might as well be a foreign language. Of course, when you put it in Chinese, you've added, a ton of complexity on top of it.
Yeah, another layer to that. Yeah, and and I do remember asking some doctors specifically a kind of about like the challenges of learning just in general. I think, and I felt like my experience wasn't that different than some of my Chinese classmates, that people were like generally kind of confused. How do we we've been studying, the modern sciences, math, chemistry, physics, what have you, all of our lives. And then now we have to start thinking in terms of yin and yang, and the 5 phases and meridian channels and things like that. And it's not that easy. And I remember asking a couple doctors, I said, we sometimes I said, even my Chinese classmates they said, I just don't have that sort of Chinese way of thinking. I just don't get it. Chinese medicine way of thinking. I said, was it hard for you? And they were like, oh no, not at all. Because that's what we said. We just like from day one, that's what we were doing. And I said, no, it didn't feel particularly difficult. Yeah. So interesting. And so I think, when you have in that world where you don't have two competing forms of medicine that you really have to master, and one of which, no matter how deeply committed we are to the Chinese medicine and how much we romanticize it or not, it's hard not to think of that biomedical knowledge as being somehow more authoritative, somehow closer to some sort of reality out there.
I think it's like having a mother tongue.
Yeah.
Right. You got a mother tongue. I mean, unless you've grown up completely bilingual.
Yeah. Yeah.
But if you've got a mother tongue, then everything else kind of gets set in relation to that mother tongue. There's always, I mean, you may be quite fluent in your second language,
Hmm.
but it's still not the axis that like your whole mind and psyche spins on.
Hmm. Yep. And I think that's a good metaphor. Yeah.
Yeah, and I think that's why it's sometimes such a challenge for us to learn Chinese medicine because we're still, even if we're attempting to put Western medicine aside, there's only so far aside we can put it. And there's always, at least for me, well, not always, but often, too often, there's this part of my mind that's trying to take my Chinese medicine thinking and still hook it in and go, oh, yeah, well, in Western medicine, it would look like that. And sometimes we can make those connections and it works. And sometimes it just comes down to, like, again, with language, sorry, there's not a word for that.
That's right. And I think and this goes back to this article too. And I think we tend to, and this is, I think, essentially what I sort of argue in this article. I think doctors in China tend to also sort of fall back on some kind of easy sorts of rules of thumb, if you will, easy little sort of tricks for like sort of navigating between the two medical professions. And one of them is, something simple like, oh, Chinese medicine is good for chronic illnesses and Western medicine is good for acute. And that's, that works. That might kind of work for you for a lot of situations. And that just sort of, it's a little guide to navigating this really complicated terrain.
Well, or it's just picking up the official party line that was espoused by the hospitals and the influential doctors who were most likely Western medicine doctors, and a little bit of governmental policy that says something acute, treat it like this, right? I mean, imagine us here in the United States right now. Someone comes in with something very acute that, maybe you could treat it and treat it successfully with herbs and acupuncture. But usually the first line of treatment would be, let's say, an antibiotic. If it goes well for you, good for you. But if it doesn't go well for you, you could lose your license, right? And of course, doctors in China are no different than doctors here. Especially when there's a system in place that's saying, here's the standard of care. We go against that at our risk.
Yeah, absolutely. I think for me, one of the great lessons of kind of this research project was also was recognizing too that I didn't even know what was possible, and I had too often there's lots of good reasons for saying, okay, we're just going to treat this with antibiotics, or we'll go with sort of the standards of Western medicine care here. What kind of blew me away was that I didn't know quite what was possible until I sort of heard these older doctors tell me exactly what they were doing in their earlier years, and recognizing, wow, there's like aspects of this medical system that I had no idea, what the potentials were. Yeah,
Because it was not available to you in your training.
it just wasn't. It just wasn't. It just was not.
So this brings up a question, an important question. You're fortunate. You spent time in China. You read Chinese. You've been able to get yourself, connected to these old doctors that you talk to. You have a bend for research, right? So you know how to go and find things. Most of us today have not been trained in treating acute conditions for the very reason that there's been no one around to show us how it's done. And because it's generally not used that way. We talk about getting to the end of the antibiotic era, and, which I remember one of my teachers in school saying, better learn your Chinese medicine really well. We're probably going to need it in ways that we can't even see right now. Right? I mean, there's that possibility. Or you could find yourself in a terrible war-torn situation where you just don't have supplies. I'm curious from your perspective, and again, you've got kind of a rarefied view. You have access to older books. You don't just practice medicine, you also know how to look at research and anthropology. But if we wanted to try to learn, how do you treat this kind of stuff? How would we go about it? Would we have to go dig out these old books? I mean, finding old doctors who do it aren't around. How could we go about relearning this stuff? Or is it even possible?
I think it's possible, and I think a lot of it is right under our noses, to be honest. I'll give you a quick example. there's a pediatrician, a Chinese medicine pediatrician that I've worked with for many years in Beijing, and her name is Han Fei. And she's built a little bit of a local reputation in Beijing. She's very good. But one of the things I was surprised to see her treating was a lot of young infants, a lot of kids with pneumonia, and sometimes she would write a prescription for antibiotics if if the parents wanted one, and sometimes she wouldn't, and I noticed that, and I was like, so you don't think you need antibiotics for that kid? She said, no, I feel pretty confident about this. And I was like, wow. So how did you get confident in that? And she kind of explained her situation, which was, she actually works near this sort of the biggest pediatric hospital in all of China. It's kind of on the west side of the city. And she says, well, I just started having a lot of kids come to me who were already, not responding to antibiotic therapies. Their parents were bringing them to me looking for something different, and so I had to started, like thinking some of this stuff's true. And she said, I just went back to like the Shanghan Lun, the Jingwei Yao Lue. I just went back to some of the classics, and you look at them in a slightly different way. You're like, that might work. And so she's a good doctor. She's very thoughtful. But I think some of the answers are maybe closer at hand than we realize. But if we don't have an opportunity to like really explore some of these formulas or some of these aspects of some of these classic texts, we don't quite ever get that mastery of it. And sort of she, by her own kind of unique situation, and there wasn't she just happened to be located. There wasn't a big pediatrics department at her hospital, but she happened to be located relatively close to like this, major pediatric center of Western medicine. And she said, just the patients I got kind of pushed me to really think some of this through. So I think it's there. It's more. It's not some incredible secret. It's just that we haven't had a lot of practice with it.
We just need to do it.
We just need to do it.
We just need to do it. And I mean, she's in a situation there. Parents with kids that were not responding to modern pharmaceutical treatment, they were showing up, and so because they were showing up, it's not like, oh, she was the first line of defense.
Mm-hmm. Right.
Pharmaceutical medicine already failed with them.
That's right. Well, and I mean, another great example, one of my favorite interviewees from this project was Deng Tiatao, who was a very famous doctor from Guangzhou, born in 1916. He's been a very, very important figure in the city of Guangzhou. And he was on multiple. I had the honor of really interviewing him on more than one occasion. And on several of those occasions, he just couldn't stop talking about the SARS epidemic. So this is back in 2003.
Oh yeah, I got to be in China for that.
Yeah. And so SARS hit Guangzhou really hard, and he said, there was no Western medicine treatments for it except these sort of massive steroid treatments, and those were come with an immense amount of risk. And he said doctors were kind of like figuring out, like, we're gonna have to try something with Chinese medicine here. And he really felt strongly that in Guangzhou, at least in the south, he said it became this really important thing. Doctors kind of realized that, hey, we can kind of do this too. So it was a little moment for sort of younger doctors to kind of reconnect with this past that only a few older doctors like him really remembered. Now it seemed like at the time they in Guangzhou, they were very interested in sort of like more wind being warm illness type of approaches to SARS. So I don't know if Shanghai, the cold damage approach is more important than the wind being warm illness approach. But
I was in Beijing when that was coming down, and I would yeah, I mean, different pharmacies were selling different their own formulations, or, oh, this doctor from over here came up with this formulation for SARS, and that sort of thing. I mean, there was a whole, I mean, the market responded, right? And different people have different formulations. Banlan gun was nowhere to be found.
right.
The Lian Chao, Jinhua, hard to find. So I would say, by and large, at least up in Beijing, that they were taking kind of a Wenbing approach to it.
Okay, interesting. Yeah, although now you would know more than me, but from the little I heard too, also that in general, like sort of the official response in Beijing though was like not sort of the more popular one, but the official response was like to not really let doctors of Chinese medicine even get involved until at least much later in the crisis. And I think down in Guangzhou, they got involved much earlier. And it was maybe later with some of the successes in Guangzhou that like Beijing officials sort of, I think, if I remember it correctly, kind of loosened things up, and there was actually a chance for doctors of Chinese medicine to get involved in treatment too a little bit. But I guess from my understanding, that happened at the end. Yeah.
I just know that like different pharmacies would have different formulations that they were selling.
Yeah. Yeah.
In terms of an official response, I don't know. I was only there for the early part, and then the town started to close down. It started getting very weird. Beijing was closing down. People weren't going out at night. It got very, people were flipping out about it. And so I hightailed it to Taiwan, where there was no SARS at that time. It showed up there a few days later. Hey, maybe I brought it in.
Interesting. But so maybe as a result of things like that, there's been a little bit of shift in sort of the public consciousness in China. I still think this, sadly, there's not enough awareness about sort of like this kind of really fascinating past that isn't that far away. Where Chinese medicine was like, the leading therapy for like all kinds of like really terrible, horrendous, acute infectious diseases. Yeah.
Well, unfortunately for us, we do have those books, and we have the principles that Chinese doctors have been using for millennia. And I think all of us love to tell the story of Zhang Zhongjing, the brilliant doctor who, in the midst of war and poverty and cholera and lots of troubles at the late portion of the Han Dynasty, takes Chinese medicine and makes this amazing stuff with the Shanghanlun. It seems that extreme conditions, in some ways, is necessary to bring about these kinds of really insightful masteries. Because otherwise, we're just hanging out and getting along with the day-to-day thing.
Yeah, I think you're right. I'd say for any of your listeners out there that are Chinese readers, just reading some of those Chinese medicine texts from the Republican period, if you've got the skills to do that, is super fascinating. And that's kind of what I ended up doing later after all these interviews, and it was all right there.
So it's all those. Do you have some examples of some of those particular texts?
Sure. I mean, there's a whole, just to name a couple of my favorite doctors, Yun Tia Chao is Lu Yanlei, Zhang Taiyan, Ye Juchen. These are all doctors I've written about. Zhang Shanlei.
And these folks all have books that they wrote.
Yeah, they all live there. These were all some of kind of the very famous. A lot of them were in that kind of what will be called like the convergence school, where they were sort of mixing a little bit of Western medicine and Chinese medicine together. But if you read the books, what's clear is it's not like today. It's really very much about Chinese medicine. There's definitely some influences from Western medicine that are very interesting, but it's a very different kind of influence, and a little bit like we talked about last time actually on the podcast on constraint. But a lot of those doctors were the two big schools of practice then were either sort of the cold damage school from the Shanghanlun, or this warm disorder school, from the sort of the Wenbing texts of the late imperial period, and so doctors were. I mean, those were I would say sort of the two main approaches, and of course within those were lots of variations, but that was roughly how they were approaching a lot of these acute illnesses of the period.
So basically, not much has changed in 100 years.
Yes.
It's funny. I mean, when I think about like old books on medicine, it's like, oh, let's read something from the Han Dynasty, or let's read something from the Ming Dynasty. Think about reading something from Republican era China. This is the first time it's crossed my mind that there might be some really helpful, useful stuff to check out there.
It's so fascinating, because a lot of these doctors also have because they're doing a little bit of the translation for you, if you will. Like it's sometimes you're reading, if you're reading these older texts, you just like, sometimes you're just like, what is that today? Like, what would that be in biomedicine or something like that? And these doctors are sort of making these connections, and being very explicit about, I'm going to use sort of the Shanghan Lun to treat, typhoid fever, for example. That was a big one in the Republican period. And in fact, a good number of doctors saw the Shanghan Lun as like, a great guide for like the treatment of like typhoid fever.
Mm-hmm. But they were already starting to make that transition from like disease presentations to using the old formulas and ideas along with modern disease names.
That's right. And those doctors are doctors that are steeped in kind of a classical world of Chinese medicine. Now, many debates between and amongst them of like, what was proper and not proper medicine, but they were steeped in that, and then kind of all of them sort of learning Western medicine later, probably as adults, or certainly as adults, but after they're already sort of really practicing doctors of Chinese medicine, and so kind of coming into that sort of encounter with this sort of already like very rich, deep foundation in Chinese medicine. So it's a little bit different than you and I, or sort of the modern student, who are sort of like learning the two at the same time and leaning a little bit more on a Western medicine and not quite sure where they stand with the Chinese medicine. So no, I found that's one of my favorite periods to read about. A really fascinating era.
Yeah. I don't suppose any of those books have been translated, have they? Into English?
Probably not a lot.
Probably not a lot. Somebody better get busy.
Yeah, somebody get busy. Yeah, probably not a lot. Yeah, but there's some good ones. There's some good ones out there.
Okay. Well, we'll put those up on the show notes page for people that are interested, or maybe have the ability to read some Chinese, or would like to translate them for the rest of us. That would be good. Yeah. So.
Yeah, I'd be happy to recommend a couple, and also some of the happy to recommend a couple texts, and some of them are radical too. Like, I mean, just like super inventive and creative in the way that they're sort of like making these connections between Chinese medicine and Western medicine. And I'll give you one for the show notes. Zhu Weiju is also another one of my favorite doctors in this period, and he basically sort of says the Shanghan Lun is the six meridians of the Shanghan Lun is really actually totally analogous to sort of like the 5 stages of infection. And he collapses 2 meridians into one, and says, and then sort of walks you through this like total, but somehow like absolutely fascinating kind of like rereading of this classic text to say, here's how you use it to think about it, infectious conditions.
Yeah.
That's wild. Yeah.
It's so interesting. And we really shouldn't be surprised, because we're doing it too. We read some of the old material, and we're filtering it through what we know. We're filtering it through our particular way of looking at the world, trying to make sense of everything. Why wouldn't those doctors be trying to do the same thing, especially if they're on the cutting edge of learning something new about Western medicine, Western biomedicine? Of course, a doctor worth their salt is going to see how they can make it all play together.
Yeah, absolutely.
Mm.
Yeah, so that's for your Chinese readers out there. It's a fun, interesting time period.
Great. Well, Eric, I thank you so much for your time today. It's always fun to hang out and talk with you about the stuff that we often don't think about in our Chinese medicine. We're usually just in our clinics treating, and you're always like digging into this old stuff, or looking at the anthropological aspects of how all these things have come into being.
Well, this was fun to talk about it, and I really appreciate the opportunity, and I think this is it's academic, but I think in the most basic sense, and hopefully it can inspire us to kind of like really go deeper with our own studies. So
yeah, well, I'm deeply heartened when I asked you the question about, gosh, how would we ever regain some of these skills that just are not being taught? And to hear you say it's under our nose.
Mm-hmm. I think so.
It's not that far away. It's a matter of taking the stuff that we've got, the stuff that's come down to us, and the situation that requires us to put it to use.
Yeah, and recognizing that somebody probably encountered this problem a long time ago and came up with a solution. So yeah, there's got to be something out there. Instead of sort of like shutting, I think what I tend to do, and a lot of contemporary students tend to do, is like, at least this was my experience for so long, is just sort of shut down. Oh, I don't know if Chinese medicine is good at that. I haven't heard about that, so probably I can't treat that.
Well, it's true. Maybe you can't treat that yet,
Yeah, that's
right?
right.
It's not that Chinese medicine doesn't do it. It's that we don't know how to do it yet.
Yeah,
Yeah.
yeah, absolutely, absolutely.
Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Geological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Geological.